industry is a portion of the profession that needs to be understood. You need to work with them because look, they just want to solve problems too, right? Like, and that's part of it. And if we can't figure out how to do that together, like you said, we will not go as far. So that's a big portion of it as well.
This episode is brought to you by PT Pintcast Media. If you've ever thought about launching a podcast to grow your brand, your clinic, or your business, we can help. We make podcasts like this one. Learn more at ptpintcast.com or just shoot me an email, jimmy@ptpintcast.com, and we can start your show today, or actually tomorrow. We're busy today. On to today's episode. What if the future of rehab wasn't something we waited for, but something we designed together? Imagine a room full of physical therapists, clinic owners, policy leaders, startup minds, all gathered together to tackle the biggest challenges in our profession: burnout, career sustainability, retention, and how we thrive in a changing healthcare system. That's what's happening this July at the APTA's Future of Rehab Therapy Summit, 2-day event in DC and Alexandria, where bold ideas are more than welcome. They're workshopped, pitched, and refined into real-world solutions. Think Shark Tank meets continuing ed, but with better posture. From learning how to bring your own idea to market to hearing what's actually working in clinics across the country now, this summit is about action over talk and solutions over sessions. And leading this charge is someone who spent his career at the intersection of science, innovation, and advocacy. From serving at the White House to helping steer the vision of the APTA, today he's here to talk about the future and how PTs can help shape it. Ladies and gents, let's welcome back Drew Contreras. We're here with the future. Drew's here. He is Drew, you're the future.
The future.
We're doing an episode on an event in the future. You've done that. So this is the future of rehab therapy.
Yes.
Leave it to a military guy to make sure the acronym is FORT.
Just saying.
I saw what you were doing there. Future of Rehab Therapy Summit. This is an APTA event. You've done something like this, though, during the Centennial.
Yeah.
That's similar, right? I mean,
we had a future of physical therapy where we've kind of talked about things in the profession, but this time, what APTA is trying to do is take more of a broader role and include our rehab brethren in occupational therapy and speech therapy, invite them into the conversation, because look, as the future shows up, right, the world keeps getting smaller and smaller, right?
Yeah.
And so we need to be working with our colleagues, and that's part of what's going to happen in this event.
I call them cousins. PT, OT, speech.
Cousins.
You know, it's like if you saw the Venn diagram, there'd be a little crossover, right? It would just sort of like mix. Like, it's funny when you see like people who work with older adults, a lot of times like the PT, the OT, and the speech therapist, they'll all show up at the same time and be like, oh, what are we supposed to do? It's like it's the Spider-Man meme when the three Spider-Mans are just pointing at each other. So what is this summit? Like, walk me through it, because not everybody can come. It's a smaller event, which I sort of like, right? It's in DC. It's in July.
Yep.
Who should come? What can they expect?
Yeah. So the venue, right, is intentionally a couple hundred people. That's it, right? It's small on purpose, right? This is not combined sections meeting. This is not a 2,000 person meeting. This is a small event on purpose because we realize some people don't want to go to an event with 10,000 people, right?
Right.
So the people who want to come to this event, right, should be looking for, number one, some specific curated topics, which I'm going to go over. But number two, a lot of time to interact and network. That's really what this is designed for, is to spend time with the other people in the room and with the presenters so that you get a chance to talk with people and kind of engage with them, right? So it's broken up into 2 days. And the first day, just to kind of go over the ballpark agenda, right? We have a really interesting clinician.
This is wild.
Who had an idea one day for a thing, took his idea and went to Shark Tank and won Shark Tank.
Close the deal. Close the deal.
Right, like legit, right? And he's a PT, right? So just kind of showing that, like, yes, you can do amazing things if you just kind of think about, well, this is where I need to go and these are the things I need to do. So that's just a really interesting kind of conversation to have in the room, right? And to kind of see what was that like. We're also going to have a panel with the CEOs of APTA, ASHA, and AOTA. Right? There's a lot of things going on, right? And so all kinds of stuff with reimbursement and billing, but also what's going on with associations and kind of how are things pivoting for the next few years. So it's an important conversation, but also kind of lets you know strategically what is our sector looking for in the broader healthcare image, right? So I think that's
Right.
super helpful, right? Then we're actually going to have a really interesting panel on non-traditional clinical settings. So PTs or OTs who have decided to go in a different direction, left the clinic, doing something else, but are still kind of touching or tangential and related. And I found this one really interesting because, you know, not that long ago, it was really frowned upon for clinicians to leave the profession and still be engaged, right?
Right.
Right. You're the bad guy, right? Case in point, you, right? Like you're
Me,
a perfect
yeah. I'm a
example.
random
Right?
podcast guy. Am I a
Exactly,
PT?
right? Like, oh, you should be slinging patients all day long. Like, but also, right, like you got to recognize that so many of our colleagues, right, have gone on to do bigger and better things, but move into the C-suite, start their own companies, right? Like just immense opportunity, but normalizing that and having that conversation because some people don't aspire to be in a clinic for 30 years and that's fine, right? But just kind of figuring out how do we use them and how do we leverage that is a big portion of that.
All right, here's a question. What would you do with an extra hour every day? It's not a trick question. That's what a bunch of physical therapists are saying after switching to Empower EMR by MW Therapy. It's built on automation and AI. So basically, it becomes your clinic's co-pilot. It keeps your schedule full, handles billing like a pro, and cuts way down on paperwork headaches. But here's the kicker. It's not some generic system. It's made for physical therapists by people who know what you deal with day in and day out. You want more patients? Done. Easier documentation? Done. Less stress? Yes, please. Empower lets you be the hero of your clinic with happier patients, less burnout, and better profits. Book your demo today at mwtherapy.com and see why switching just might be the easiest win of your year. As Rebecca Griffith, friend of the show, would say, using your familiar skills in non-familiar places. Like, we want everybody to know about PT, and we expect if we stay in a clinic and scream about it, that's one way. But if you leave and PTs wind up in a C-suite or wind up in a tech company or wind up somewhere else, it's a way to show versus tell, and show beats tell.
Yeah. And I think that, it's just one of those things that it's the time has come, right? That we understand and truly appreciate, and in some instances uphold it as like, this is a great opportunity. This is a great thing, right? And so normalizing that, having that be a part of the kind of the narrative for the profession is really important. So we're gonna spend some time on that.
An event is not an event. I mean, people are smart enough to know you're not throwing this event for the sake of throwing an event, right? You're throwing an event because an event is a way to solve problems or at least get people knowing or talking about
Yep.
these problems. So here's a curveball a little bit from your perspective.
Mm-hmm.
What are the biggest existential challenges facing, I guess, not just PT, because we've got AOTA and ASHA, right? What are the biggest crises, the biggest problems facing our professions together that hopefully conversations from the Future Rehab Summit.
Right. And that's like literally like the thematic of a summit, right? Is
Right.
to like address a concern, right? And I think the bigger concern that we have to think about is that if you kind of look at where medicine in general is going, right? We have a significant problem coming with a lack of primary care physicians in the system. Like it is not like gonna happen. It's here and it's about to step off a significant challenge,
Correct.
right? And so, right, that's a whole nother conversation about like why aren't physicians interested in doing primary care, right?
Right.
Well, there's the whole conversation. I don't want to get into that, but my point is that as that gap gets wider, and as people need to kind of figure out who's then going to step into that role, understanding that like as a doctoring profession, we can have a slice of that and we are well suited to fill a significant, portion of that. The other conversation is right as the other big conversation on that first day is an AI conversation.
Yep.
And AI is here. We all like, okay, God, like you and I had this AI conversation probably a couple of years ago, right?
Correct.
But now, right, like now the question is not how's it gonna be used or utilized, right? Now the question is like, to what extent and
Genie's already
how?
out of the bottle. Genie's out of the
Yeah,
bottle.
yeah, it is right. And so, there's a that's just a huge conversation, and it's a thing that if you, I just went to a meeting, the National Academy of Medicine, and it was summed up as this, right? If you're not in the room if you're not at the table talking about AI, you're going to be
You're,
on the menu, right?
you're
And that's what
smoked.
they said in the room, and I was like, man, that's completely true, right?
You're
So,
smoked.
right, so the professions have to start to understand, like, we're about to have another digital revolution. It's really going to be impacted in healthcare, and we have to be a part of that conversation to make sure that, like, we're leveraging it and we're accepting of it and we're positioning it for the best good for everybody, right? So that's a big, huge portion of the conversation that we need to have.
Yeah. I like the fact that it's not a huge event because what I also like is these are conversation starters. At no point should you think that a solution is going to come out of a summit. It's not the
Yeah.
goal. That's not
No.
how things are not, that's not how problems are solved, right? The spark, the back of the napkin might happen in the hallway at the Future Rehab Summit. And then two people who wouldn't otherwise have met would meet under these circumstances. And you can't, I don't know if you can do that with an 18,000 person CSM. You can do it with something like this.
Yeah.
So let me ask you this.
Yeah.
What ideas are you hoping to see a year from now? Like you're putting together oxygen, nitrogen, hydrogen, you're putting elements in the room and saying, I hope there's a big bang. Like, what are some things that like pie in the sky you'd like to see?
So that actually flows really well into the second day. So the
Okay.
second day of this, we're having some other curated topics about. So if you have an idea, how do
What do
you
you do with it?
what do you do with it? Like, how do you make a pitch for that? How do you, if you have a product, like, hey man, you probably should get a patent, right? So we're gonna go. We have some people from the patent office, like, you need to protect yourself, right? We have people about, well, how do you make a pitch, right? We have people who have done pitches in the room, like, hey, I've done several of these, and this is what's good. So that what I want is people to start to understand that everybody who's in that room has probably had a great idea at some point in time, but maybe didn't know how to capitalize on it or didn't know what was the process for it, right? And I think that teaching people, hey, look, if you've got an idea, here's the opportunities for you, right? And then I also think that the other thing we're going to talk about is like, so maybe you've already got this idea, maybe you're already doing a thing. Like, well, how do you get funding for that? How do you get investors to believe in you?
How
Because
do you
what I
communicate it?
suspect is, yeah, and how do you do it? How do you do it well, right? But what I really hope is that some people that are in that room, as we're talking about problems and concerns, go like, you know what, I actually have an idea, and I have a potential solution, and maybe there's some other people in that room that, hey, let's have a conversation about that, right? So intentionally, there's a lot of networking time for these opportunities and conversations to happen, and I think that the one thing that we really have come full circle on is, during COVID, we were like, we can do everything online. And like, you can do a lot of stuff.
Yeah.
But at some point, humans are humans.
Yeah.
And putting a couple of human beings together in a place with some time and some energy brings about great things. And
There's
that's really what
bumpability.
we're hoping for. Yeah.
Yeah, I mean, you can do great follow up. You can maybe meet someone, but always and never. Sky Donovan taught me this. She goes, "Hey, listen, you see an always or a never on a test, it's probably not the right answer, right? Because all you gotta do is find one. And so, is everything online always the best? Should you never? No, absolutely not. It is harder to scale in person events, but that's why the right events are the ones to go to. July 9 and 10, Future of Rehab Summit. Information at APTA and their website, apta.org. You've got a very unique vantage point, right? Your office, we're gonna like a literal, like your vantage point in DC. You overlook DC.
Yep, that's right.
It's not an accident where APTA built their
Nope.
building. There was no metro station when you built it. There is a
Nope.
metro station now. Look at that. There was no connection. Now there is. It's almost like you
Come
guys planned this. But there's other people in quite literally the APTA's neighborhood,
on. Mm-hmm.
companies like Amazon,
Yep.
companies like Apple, companies like Google. So I'm sort of tipping my hand where I
Yeah.
think you're going to go, but where do you hope to see PTs playing a broader healthcare role in the next decade? Like where should we be, but we're not now. But if we're not in 5 to 10 years, we're in trouble.
Yeah, and the point that you're making is that as healthcare broadens the reach, right? As other companies step into the healthcare space, like we're saying, Apple, Google, Amazon, right? Like they're all in it, right? They're all in the space, right? And PT, by the fact that we're the profession is the solution for so many problems if applied. The problem is if people would do it themselves, then we wouldn't have you wouldn't need anybody who does it for a living, right? So every time like I see some digital companies like we're going to replace in-person PT with an avatar, I'm like, you've clearly never done the profession, right? Because
Right.
people need people to help them along this process. But physical therapy also needs to find its place in all these other providers that are going to do things at scale because we provide a solution that not a lot of other disciplines do.
They
And I
can
think
bring
that,
Amazon and Google and Apple can bring things like scale and
yes,
audience and
yep,
PTs instead of doing us or them. I don't know. This is personal. Now I'm just putting my. I'm not even
yeah,
asking you a question. Us and them is the answer. Us and them.
right. And like again, like I don't need to talk to this audience anymore about like the impending onslaught of the over 65-year-old patients
Yeah.
that are coming, right? They are coming, and the difference is, right, like they're not, if they're exiting the workforce at 65 ish, whatever, right? They're still planning on living another 25 to 30 years, and they're going to. So, like, they're going to continue to use medical resources. And, like, other than pills and potions, right? Like, we're the ones who are most likely to be able to put our thumb on that and have an impact on the big healthcare scale. And I think that's really important for us to be a part of that conversation.
All right. If you're still doing all your notes by hand, we need to talk. Athelis AI Scribe is changing the game. You walk in, you talk to your patient like you normally would, you treat them, and boom, your notes are drafted in real time. Thanks to AI. No voice commands, no clicking around. It just listens and writes like a scribe, but smarter. People are cutting their documentation time by 90%. That's not a typo, 90%. That's actual feedback from real clinicians using it now. You want to see it in action? Go to athelis.com and take a test drive. That's ATHELAS.com and say goodbye to after hours charting. All right. Two days, July 9 and 10, I mentioned. Dan Stats, PT that you mentioned from Shark Tank. You're going to have the CEOs from all those organizations, APTA, ASHA, AOTA. Industry innovation, we're definitely going to talk about AI. And then the next day, very tactical, how do you actually do those things? If someone's listening right now and they're saying, I'm glad you're doing this, I can't come to the summit, what should I do to sort of follow? I can't come to the summit. I'm busy, whatever. Again,
Yeah.
not everybody can come.
Yeah.
What do you suggest people do to stay engaged, to stay and be able to move the needle forward if they don't feel like they're in the club? There is no club,
Yeah.
just a spoiler.
Well, I mean, I think that we're at APTA, we're trying to build out some communities, right, where people can interact, have these interactions, right, with other people of like-minded things, and that's part of the online APTA community. But separate from that, right, outside of APTA, what I would say is whatever your place is, invite us into it and let us come there, right? I'm happy to come talk to anybody who's got questions or they've got their own cohort of people doing their thing. Let's have that conversation. Let me know what I can do to help, right? Let me know what my colleagues can do to help leverage what you're doing, right? Like it's a two-way street, right? And I think that that's the reality of it, which is also why if you come to the event, you're going to see some industry giving presentations and talking and being a part of it. And I was at a separate event and I got a really pointed question from somebody. They were like, "Tell me why APTA is working with this company. Why are you, quote unquote, in bed with them?"
Oh,
And I said, "Look, man, that's you. Feel free, like ask away." But the reason APTA is working with companies is because companies see the value in physical therapy. They see the value in what we do, and they want to work with us. And of course, we do our due diligence and vetting as best as we can, right? But the point is that like the future of medicine involves industry, especially when your cousins and brothers and sisters with the same initials are working for industry, like
Yep.
to not engage them is silly and foolish. So, right, because they're the ones, right, who then can implement the concepts and the ideas we have. They're the ones who can deliver the things.
We've done it a lot on our own, and
Yeah,
we've gotten some good results. But what's that African proverb, right? If you want to go fast, go alone. You want to go far, to go together. Like that's quite literal. Like you can't get into some places or scale because you can't be great at everything.
right. Especially, right, when you start talking about, large language models, right? Like I am not, right? That is not my lane. I have no business even having that conversation, right? But I know people that do, and I know some of my colleagues who work with them. So it's no different, I feel, right, than us working with researchers, right? Trying to figure out other problems. So like
Sure.
industry is a portion of the profession that needs to be understood. You need to work with them because look, they just want to solve problems too, right? Like, and that's part of it. And if we can't figure out how to do that together, like you said, we will not go as far. So that's
Yeah.
a big portion of it as well.
All right. So I'll let you do the parting shot. So this will be the last question before you give your parting shot, right? And we will see you. I'm coming. I'm going to be doing some interviews on site, and I'm there to learn as well. Because if you're not, I still think you're behind the 8 ball. So last question before parting shot. If someone asked you what is at stake if we don't, as a profession, innovate fast enough, how would you answer? What's at stake if we don't innovate?
You know what? There's a perfect example that everybody is super fresh in your mind. You will be the restaurant that would not deliver food during COVID. That's what you'll be. No, 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 I'm not going to deliver food, or no, I'm not going to adapt to this. Like, how many of those restaurants are still around? Right? Shuttered. Thousands and thousands of them. Feel free, right? Keep saying you need to come get my VCR tape at Blockbuster. Right? Feel free, right? Like, and the thing that is hard, there was this great quote that I've used, and it's really difficult, but makes so much sense, is that as fast as this is, things will never be this slow again.
Correct.
Things are just going to get faster. So if you're struggling or not understanding that, like, this is fast, this is coming fast, like, yeah, it is. And you know what? 5 years from now, it'll be 2x, 4x, 8x. Like, it's not going to slow down. So this is that concept that, like, you must start adapting now. Like, it's already too late to think about it. You have to adjust, right? And as the profession needs to adjust, so do the clinicians, the educators, the industry, because it's coming, right? And you can either be at the table or you can be on the menu. Those are your choices.
Adapt or become extinct. Drew Contreras is what I'm hearing. All right, parting shot. Last thing we do. What would you want to leave people with specifically about the summit? I want people to understand, because there are some spots available still as we record and release this. It's not for everybody, and I think that's what makes it cool and sort of you want to be in the room where it happened, right? To drop a Hamilton quote.
Yeah, I think that, my parting shot on that is just that if you can't make it, no worries, right? We will be doing more of these things, right? But if you are interested in these sorts of things, be open to the conversation and be open to the people who will say things that come out of this, right? And that's what I really hope, is that something somewhere, like you said, somewhere something caught on fire, and it's just a slow burn after this. Look for more of these things. Look for more opportunities like this to kind of push things forward, and I think you're going to see them.
APTA Future Rehab Summit. Find out details at apta.org. July 9 and 10. Not a bad place to be in Washington, D.C. A couple days in the summer. Pretty good. And I know we'll have some evening activities as well. Just check the socials. We'll be out.
Yeah, absolutely. And again, like, if you do decide to come, be prepared to spend a lot of time networking and talking with other people, because that's really what this is designed for.
True. Thanks so much for the time. Thanks for doing this. Without these interaction points, we can't innovate. We can't move forward.
Absolutely.
Perfect. Let's be real. You didn't become a therapist to be average. You've got something in you that wants more mastery, more impact, more confidence in the clinic. That's exactly what Brooks Institute of Higher Learning delivers. Their residency and fellowship programs aren't just resume builders, they're transformation zones. You get one-on-one mentoring, deep dive classwork, labs, and real-time experience inside one of the most advanced rehab systems in the country. And the best part? You're not grinding this out on the side. You get a full salary and benefits while you train with the best. Whether it's ortho, neuro, peds, geriatrics, women's health, Brooks IHL helps you become the expert you know you're meant to be. Check out brooksihl.org to learn more and take that next step.